Welcome to another session of Understanding Human Anatomy, and the last of the series dealing with portal circulation. And in this video, I want to discuss areas where there is connection between portal drainage and caval drainage, and where we have portal-caval anastomoses. For the most part, these will be places where organs are supplied by both paired and unpaired branches of the aorta. I want to start by drawing in a little bit of esophagus along with stomach. And I want to bring this in because the distal end of the esophagus is supplied by esophageal branches from the left gastric artery, so there'll be left gastric branches draining. But the esophagus is also supplied by paired branches of primarily the thoracic aorta that is supplying the esophagus all through its descent through the thorax. So the distal end of the esophagus, right here, has both caval drainage and portal drainage, and there is anastomoses between the portal and caval veins. So the esophagus is one location of portal-caval anastomoses. Another area that receives a dual vascular supply is at the other end of the digestive tract, and that would be down at the rectum. And the rectum receives vascular supply from the inferior mesenteric artery, but also from paired branches of the aorta coming primarily from the internal iliac artery. So again, in the rectum, we have dual venous drainage, and that we will have anastomoses between the veins, so we get portal-caval interconnections. So the rectum would be the second one. And of course, in the rectum, we have the hemorrhoidal vessels. And the hemorrhoidal veins can become engorged with blood and project into the lumen And that would be what we call hemorrhoids. Now, other places that receive dual supply from paired and unpaired branches of the aorta and thus are drained both by the portal and caval systems are the organs that are secondarily retroperitoneal. So we have the duodenum, and we have the pancreas, sitting in here like so. And since the duodenum and pancreas are secondarily retroperitoneal, they get a vascular supply from the unpaired branches, both the celiac and superior mesenteric arteries, and they get blood supply from the arteries supplying the body wall. And these structures are on the body wall. So the vessels supplying just in general the body wall, which are paired branches of the aorta, would supply them. So duodenum and pancreas is the third area where we have portal-caval anastomoses. Another area that is secondarily retroperitoneal is the ascending colon, and the descending colon. Both are secondarily retroperitoneal. And again, like the pancreas and the duodenum, they get a vascular supply from the unpaired branches, the ascending colon from the superior mesenteric artery, the descending colon from the inferior mesenteric artery. So the ascending colon and the descending colon are the fourth and fifth areas where we have portal-caval anastomoses. Again, body wall arteries supplying both the ascending and descending colon along with the superior and inferior mesenteric arteries. The last area I want to mention are the para-umbilical veins. So let me sketch in a liver. And then from the liver, let me indicate the para-umbilical veins. Again, this is a pair of veins that go out to the body wall. And we'll put the label right here. And recall that the para-umbilical veins go to the area of the umbilicus, the belly button, and there they merge or interconnect with the veins of the body wall. So again, it's a connection between the caval circulation, the veins of the body wall, and the portal circulation, because the para-umbilical veins drain into the portal vein. Now, the reason that it's important to understand these areas of connection between the portal and caval system is when blood flow is interrupted in one or the other system. Recall that the veins of the trunk, as well as the veins of the head and the neck, do not have valves in them. Valves are only found in veins of the extremities, of the upper and lower extremity. That means blood can flow in either direction through veins in the trunk. So if blood flow through the portal system is somehow impeded, the blood will back up into the caval side to be drained. Likewise, if there was a blockage in the caval system, it would back up into the portal vessels to drain. Now, when this happens, it puts a much larger flow of blood through the vessels. And the vessels can then become engorged with blood. They can become varicose veins, and thus can be a problem. Most people have heard of hemorrhoids. Hemorrhoids are nothing more than varicose veins in the rectum and anus. They're veins that become engorged with blood because their normal pathway is blocked and it's backing up. One of the primary causes of this type of situation is diseases of the liver, which cause a blockage of the portal circulation. If the blood can't flow through the liver as it was intended, then it will back up into these other systems. and we call that portal hypertension. In the next slide, we'll discuss portal hypertension. As I said, portal hypertension is caused by an obstruction to the flow of blood through the liver. Common causes include cirrhosis, liver cancer, and hepatitis. Now, when this happens, there will be increased blood flow through the portal-caval anastomoses to the point that the veins in these areas will become engorged with blood and thus become varices, varicose veins. Now, common signs. Well, one of the easiest to recognize are hemorrhoids, which are varices of the hemorrhoidal veins. They become engorged with blood, and then the vein actually pushes into the lumen. And if it's engorged with blood, it'll be relatively rigid, and then when fecal material moves past it, it causes the vein to break and bleed. So hemorrhoids can be a sign of portal hypertension. Hemorrhoids, although are seen in portal hypertension, have other causes as well. Principally blockage of the caval system. Another common cause of hemorrhoids is pregnancy, where the growing fetus puts pressure on the veins of the abdomen and then forces blood into the hemorrhoidal vessels and causes hemorrhoids. With liver damage, with significant liver damage, we see varices in the esophagus. These esophageal varices are found at the distal end of the esophagus, and what they will do is bleed into the esophagus when food is swallowed. They are very problematic because it's hard to stop bleeding from these vessels since they're so deep down the esophagus. And oftentimes people with esophageal varices will vomit blood because of all this blood getting into the esophagus. Another sign that you see usually in severe liver disease, is a sign called caput medusae. Literally translates into Medusa's head. And what you see are varices radiating around the umbilicus. Caput medusae is caused by portal hypertension passing through the paraumbilical veins to the body wall, thus causing the varices in the veins of the body wall radiating around the umbilicus. And the name comes from the mythological creature Medusa, who had snakes growing out of her skull instead of hair. These varicose veins, these varices that you see moving out, resemble small snakes growing laterally from the umbilicus. And when you see caput medusae, it's usually a sign of very severe liver disease. If portal hypertension is not managed, it will lead to death. That concludes our discussion of portal circulation. Thank you for your attention.